Please go ahead.
A very good morning to one and all present here. I wholeheartedly welcome you all to the 12th lecture in the year, Understanding Autism and its Practical Implications for Medical and Dental Practitioners. Our esteemed speaker for the day is Dr. Sonali Kataria, Sirohi. But before we start introducing our speaker, I would like to thank the associations, without the constant support of whom we wouldn't have been able to conduct these lectures. So we are very thankful to Dr. Arthur Goria sir for the support of Indo-Pacific Academy of Forensic Odontology, Dr. Emilio Nozales for the partnership with Association Forensic Odontology for Human Rights, Dr. Jasuja and Dr. Neeraj Grover for the support of Indian Association of Craniofacial Identification. Now, coming to the speaker of our day, she's the head and co-founder, Sunrise Learning Center for Autism and Special Needs Noida, a TEDx speaker, ex-consultant AIMS. Now, if I have to brief you about what Sunrise Learning Center is all about, it is a non-profit organization dedicated towards providing empowerment, education, employment, vocational training, inclusion, support services to children and young adults with autism and other special needs. And not to forget their families too. This was founded by Dr. Parents of a Child with Autism in 2015. This organization now runs several programs that are dedicated towards independence and dignity of persons with special needs. Well, reading this, it reminds me of the saying by Elon Musk who said that when something is important enough, you do it even if the odds are not in your favor. Well, we can actually go on for a very long time to introduce our speaker, but I'll just shorten it up and I'll give her the time to speak for her topic. Talking about her education qualification, she's an MBBS, MD Neuroanatomy, DNB Neuroanatomy, postgraduate diploma in education administration. She has undergone several programs before joining this autism program, the Sunrise program from Autism Treatment Center of America, Massachusetts, USA, teachers training in special education, learning disabilities, ADHD, autism from American Teacher Institute, certification in autism specialization, IBCCES, and a certified play therapist. Through her awards, there are many awards, but I'll just name a few notable ones. She was nominated for Sophie's Women Awards in Social Excellency category 2015, 19th Stree Shakti Award 2018, organized by Ganpati Sansthan for her remarkable work in the field of women empowerment, PMI Achievers Award 2018 for her outstanding work in the field of empowerment of persons with special needs, International School Award 2019 at Dubai for phenomenal parental engagement. With this, I would hand over the screen to Dr. Sonali ma'am, and the stage is all yours. Thank you for accepting our invite, ma'am.
Thank you very much for the hearty welcome and the introduction. It was hearty indeed. Thank you very, very much. And
Pleasure, ma'am.
I had actually forgotten about these awards. Thank you so much for reminding me, making me feel so good. So please let me know if my screen is visible.
It is
Yes, it
visible,
is.
ma'am.
Yes, it is.
And before going ahead, a very, very huge thank you to Team IPL for giving me this opportunity, for this chance to come and speak about something that is very, very close to my heart, which is my life and my soul, and that is inclusion of people with special needs. So thank you, Team IPL. Thank you, Dr. Aman Chaudhary. Thank you, Dr. Priyanka Kapoor. Thank you, Dr. Deepika Popli. And thank you, Dr. Pooja. Thank you so much. And I also want to thank the societies and the associations who have, heartily taken this first step, taken this huge step. May not be the first, but it is a huge step indeed to bring about and create a system of networking where people can actually share ideas and grow together. So today we are taking this topic of understanding autism and its practical implications for medical and dental practitioners. all of us are doctors, and it is very, very imperative that we understand the needs of people who cannot speak up for themselves. So therefore, if we have to head towards inclusion, the first step would be understanding. Understanding, which brings more awareness, which brings more acceptance, and then takes us towards inclusion. And this is Dr. Sonali. As already introduced, Sunrise Learning Foundation is an organization that works for employment and empowerment. And we have some wonderfully specially abled people who are our employees who are doing wonders. And we are so proud that we have come a long way in helping and supporting our friends, our special friends, towards inclusion. Already introduced, this is my greatest qualification. All the fancy qualifications and degrees from India and abroad have not taught me what my children have taught me. So this is my greatest qualification, the greatest teaching that I have ever, been able to acquire. So today, our question for today is our healthcare system inclusive? Are we taking steps to make sure that the healthcare system, the mighty healthcare system of India, are we taking enough steps to make sure that we are able to include the people who have special needs? So what is the real big deal? Why are we even discussing this? People on the autism spectrum are often less understood, misunderstood, due to their difficulties in communication and social interaction. So they have excellent, amazing cognitive skills. I'm sure all of you know about this. They have some amazing cognitive skills, even way better than regular population. And they have some amazing visual strengths. But they have difficulties in adjusting with social environments. That is where the huge barrier comes. They have difficulties in adjusting with crowded places, with smells, with stimulating new environments that require waiting or sitting quietly, and complex executive functions like understand and then follow instructions. That is where their difficulties are, and that is where the barrier comes in, where they are not able to access the healthcare systems that we currently have. So what is really the problem? The problem is that they are vulnerable to many health issues. They are extremely vulnerable to many health issues, especially anxiety, depression, headaches, sleep difficulties, gastritis, gut issues like diarrhea and constipation. They have extreme gastrointestinal difficulties, very common. Frequent infections. They also have frequent falls, injuries, and accidents because of their inability to judge social situations around them. And they also have some difficulties like dental caries, which is very common due to the hygiene related issues. But despite all these vulnerabilities and their great need for the healthcare access, they are sort of left out only because of one of the very big factors is that they have complex social limitations. Their complex social limitations limit them and create such huge barriers for them that their health issues remain unaddressed and unattended many, many times, which is unfortunate and sad. So gradually, in all these years, two separate worlds have been created. There is a neurotypical world where there is access to healthcare systems. Of course, they have their own challenges. Of course, the system has its own difficulties. But there is another world, that is the neurodiverse world, where they are not able to reach out to these healthcare facilities. And so we actually need to build a bridge. We need to build a bridge. And the first step to building a bridge would be awareness and understanding. Creating awareness amongst people, in the healthcare professionals and in the common people would definitely lead to creating a system where we'll have inclusion as part of the system. So that bridge, to build that bridge, we actually need to put the first brick. And seminars and webinars like these, um, networking like this is actually being the first brick. So today, congratulations, we are again adding one more brick to this bridge that we are building between the inclusive healthcare system and the regular world and the neurodiverse people. So I want to congratulate all of us for being this brick, being the next brick in the bridge that we are trying to build. So if we want our healthcare system to be inclusive and take care of people with special needs, we will have to be the change. We will have to be the change, nobody else. So life is a long journey between human being and being human. We are all human beings, and we need to take that step for being human. So being the change, what does it take to be the change? First, we need to understand why do we need to be the change? Then what can we do to be this change? And then how can we actually do it, practically do it? So why? The big why is, why do we need to be this inclusive for the healthcare systems? So the answer is, like, just like any other person who comes to a clinic or a hospital, a person with autism will also have to visit the hospital for any XYZ reason, for any condition, and then not being informed about autism. We as healthcare professionals not being informed about autism would be something very, very unethical and even criminal for that matter. So we have to be informed. And very commonly visited OPD and health setups, like everyone else, is dentists. People have to go to the dentist very often. They need to visit the ENT specialist very often, the pediatricians very often, the physicians because of the general conditions, the ophthalmologists, especially in case of autism, gastroenterologists. The people with autism have to visit the gastroenterologist pretty often, clinics of psychiatrists, and sometimes the emergency rooms and the diagnostic centers for X-ray, ultrasound, for CT, MRI, SPECT scan. So these are the commonest places or health setups that people with special needs need to visit. And to understand about autism and the needs and the bridge that we need to create, we'll start with Bholu. I'm sure those of you who attend my talks and webinars regularly identify with Bholu, know Bholu very well. For those who do not, let me tell you, Bholu is 8 years old, and Bholu will help us to understand a little more about autism. So Bholu is an active, smart, happy-go-lucky boy, but sometimes he's hyperactive, distracted, he's running from one place to the other, he's jumping, throwing things, climbing, then crashing down. He's always on the move. He is on the autism spectrum. He's an 8-year-old boy on the autism spectrum. Now we'll go a little bit deeper into Bholu's story. Bholu does not speak hardly any words here and there. And more importantly, he does not communicate either effectively. Effectively, he's not able to communicate through body language or gestures or expressions. So meaningful communication is lacking. In fact, he's not able to point to objects with his finger like this. Clear pointing he's not able to do, or anything that he wants to show. And he's also not able to follow our pointing. If the parents are pointing towards something, Bholu, look at the aeroplane, Bholu, look at that dog. So Bholu is not able to follow the direction of the pointing that is being shown by his parents or his teachers. And he does not respond to his name. Bholu, 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 come here. Bholu, stand. Bholu, come. He is not able to respond many a times to his name being called or to small instructions that are being given to him. So there is a very big lack, very big difficulty in communication. Bholu also does not give eye contact when he speaks to, when he's addressed, when he's trying to, interact with somebody. He finds it very difficult to look at them in the eye. He is also not able to share play meaningful play, with social smiles, with laughter. He is not able to play with his toys meaningfully, or he gets anxious when a lot of children come towards him. He gets anxious. He also is not able to react to the social environments that are happening around him. So mummy papa are going, he's all right with it. Mummy papa are coming home, he's all right with it. So he's not even aware of danger. Say for example, something is falling down over him, he's not aware of that immediate social environment. So it seems as if he's inside a bubble. It seems as if he's withdrawn, he's detached, he's lost, he's disconnected. So there is a clear difficulty in social interaction, in the area of social interaction. Bholu also does some activities repetitively for hours and hours and hours alone. So he can line up toys or objects, he can stack up towers, blocks, he can arrange the blocks in a specific pattern. This condition is called sensory disintegration. He has some sensory difficulties in coping with the environment, and so he has adapted to some coping strategies. He's coping with all the stimulation that he's getting from the environment, which he's not able to filter out. Like we are able to filter out the sound of that fan and that AC and that flickering light and that sound in the background. We are able to filter all that, and we are able to focus on what we are actually doing. Bolu is not able to do that. He doesn't have those filters, or the filters are a little weaker. So to cope with all the overstimulation that he's getting, he does some activities to keep himself calm. These are called coping activities. So he kind of seeks sometimes visual and auditory information. Like for example, he'll open the shampoo bottles and he'll try to enjoy the lather that is produced. He'll open all the taps and he'll watch running water for hours. He'll spin himself or sometimes see spinning objects like the fan or the wheels of a car. He would watch some lights flicker, microwave lights, washing machine lights. He'll watch the tick, 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 tick of a clock. He would watch patterns, vertical stripes, horizontal stripes, colors, or some kind of movement, like when the car moves, he wants to see outside the window. He wants to sometimes emit sounds to hear those sounds. So he'll do some humming sounds, or he'll throw some utensils to hear those sounds, or he'll throw blocks, or he'll lie down on the floor and tap on the floor to hear those sounds. So basically, he's trying to seek some sensory information, which is kind of tuning him out from the background information. Similarly, he also seeks other kinds of sensory information, like when he's anxious or he's alone, he could rock his body like this, front and back, or he could wiggle his fingers in front of his eyes and keep watching those fingers, or he could spin, or he could sit in a W position as shown in this picture. He would sometimes switch the lights on, off, on, off, on, off, and he would sometimes walk on toes. And sometimes he would press himself against a hard object or a person to get that pressure feeling inside his brain. That's called proprioceptive seeking. So he also has some fixations, some obsessions. Like for example, if taken to a mall, he would want to just go up the escalator and come down. If he sees a trampoline, he cannot resist himself from jumping. If he sees a water pool, a swimming pool, he might just jump into it. If he has a screen or access to a video, he might be addicted to it. If he sees a swing, he would want to just go on and on and on. Or there could be some obsessions related to Legos or blocks. So Bholu has many fixations which lead to a lot of control battles with his parents or with his teachers, leading to even more difficulties in creating a good connection between his caregivers and Bholu. So basically, he's anxious. He's very anxious. He's often very anxious. And he's also labeled as a difficult child many a times. So he's anxious because he's also scared of sudden sounds that can startle him, sudden lights, sudden touches, somebody comes and touches him all of a sudden, sudden smells that emerge. So he's very scared of unpredictable environments. Uncertain, unpredictable environments are very scary for Bholu. And he's also finding it very difficult to accept new situations as he's growing up. He doesn't like to go to parties because there's a lot of sound, lot of light, lot of crowds, and there's so much unpredictability over there. He also has huge difficulties in sitting on the toilet seat. So many a times he has to be in the diapers. And he has some difficulties in wearing new clothes or woolen clothes or clothes that have a certain feel or a texture to it. He has phenomenal difficulties in accepting touch to his hair or to his face. Haircuts are horrible events in the family, and so are nail cuts, and so are the processes of brushing teeth and rinsing. Because he has extreme sensitivities on his peripheries. He also has limited picky eating habits. He could eat maybe chips, maybe dal chawal, and no medium consistency foods, simply because he has a lot of over defensiveness, hyper defensiveness, hyper sensitive oromotor areas. He also doesn't sleep. Bolu doesn't like to sleep before it's 2 or 3, and his parents are exhausted and drained, and his parents' social life has been cut off because all the reasons that we just mentioned. So basically, there are a lot of control battles in their family. There are frequent meltdowns. Meltdown is when there is a flood of emotions that happens and that nobody can control. And these meltdowns have happened in the park, they've happened in the hair salon, they've happened in the market, in the mall, on the road, in the car, in the restaurant, in the movie hall, at the friend's place last time when we went, at the wedding party. So pretty much all social situations, these meltdowns have happened, and the parents have kind of cut themselves off, and they've kind of stopped going to such complex social situations which could give rise to such meltdowns. So we are trying to understand autism through Bholu. Bholu is helping us to take us into that world which is beyond that glass wall, and that's Bholu's world, and that's autism, which he's not able to explain. He's not able to stand up and explain to us. So we have been understanding something about autism through Bholu, and now I'm going to give you some eye-opener facts about autism. Some of you might be knowing them, and it might just blow your mind for some of you. Is it really a big deal? How many people of autism could we have? 1 in every 54 people. According to the latest survey of CDC 2016, every 1 person in 54 people has autism, is on the autism spectrum, and this is reported. There are so many people who are still not reported, who are still not diagnosed. So an estimated 3 to 5 million people in India have autism, are on the autism spectrum, which is a huge number, which is a very, very huge number to deal with for our healthcare systems, for our society, for our world. It's time we open our doors and windows, and it's time we build that bridge of inclusion. One more fact: people with autism, children with autism grow into adults with autism. They do not outgrow their autism. Many people feel that once he grows up, he's going to grow out of this autism spectrum. They grow into autistic adults. But yes, if the childhood has had good tools, appropriate tools of teaching and training, the adults are undoubtedly amazingly independent and confident in conducting themselves. So they can live their lives with dignity, with independence, if the right tools for support and learning are given at the right age. Another fact: Autism is a spectrum, an entire umbrella under which we have these four conditions called autistic disorder, Asperger's syndrome, PDD, and CDD. All these conditions come under the spectrum umbrella of autism. Autism. Another fact: people believe and say, and very commonly say, this person has autism. He doesn't really look like the person I met last. So it is very important for everyone to understand that if you've met one person with autism, you've just met one person with autism. Each person comes with a unique set of abilities and limitations. Each person on the autism spectrum is very different from the other person on the autism spectrum. So this entire spectrum is a huge continuum. It is a huge continuum. There is a wide variation in the type and severity of symptoms that people experience, not just varying from person to person, but also in the same person from time to time. Say, for example, one person who is on the autism spectrum has extreme limitations in his fine motor and executive functioning. At this time, that person might have some, learn phenomenally his fine motor skills, and he can improve beautifully over a period of time on those things, but his language would still be deficient. Similarly, a person on the autism spectrum at one time of the day is very interactive. He's coming to us, he's trying to talk to us, he's even trying to look at us. At another time of the day, he is trapped inside his bubble, and you cannot reach out to him at that time. So it is a very, very big spectrum within a person and from person to person. Who is affected? This many of you, I'm sure, know. 4 to 5 boys for every one girl are diagnosed with autism. So the ratio is more towards boys. And autism spectrum conditions occur in all ethnic, racial, and economic groups. What causes autism? This is the most heartbreaking fact, mind-blowing fact. What causes autism? We don't know. We don't know yet what causes autism. We have some clue that there are some environmental factors and there are some genetic factors, and that's all we know. A lot of research has brought out a lot about the causes. However, what causes autism? We don't know. Still a question mark. Now, many of you already know that there are many famous authors, many famous musicians, and many famous scientists who are supposed to be on the autism spectrum. And many of you would also know that the face of Apple, the person behind Apple, Steve Jobs, is also considered to be on the autism spectrum because of his specific strengths and specific limitations. Similarly, very passionate, single-minded people like Bill Gates are also suspected to be on the autism spectrum. Now, this woman, she is Dr. Temple Grandin. She is a professor in the University of Colorado in the Department of Animal Research. She has done revolutionary work in the field of animal husbandry, and she has published many books about the same. Most importantly, she is the first and the most important person on the autism spectrum who has helped us to take a peep into that world. She has directly given us so much information about what it feels to be on the autism spectrum. She is Dr. Temple Grandin, ladies and gentlemen. She is on the autism spectrum. She was diagnosed with severe autism when she was 4 years old. Since then, she has had a very difficult childhood, but thankfully, she was given tools to progress and to develop herself, considering all the uniqueness into converting them into her strengths. And that's how she is a famous author now, author of many, many books, and a very strong motivational speaker and an autism advocate. And incidentally, she was also the first person who I met when I started off with my career as an autism specialist. She was the first person who I heard in a live gathering, and she touched me to the core. If you hear her TEDx talk and you listen to her, you will realize why she's so special and why she is who she is. Some of her quotes are very famous, like this one: I can remember the frustration of not being able to talk. She was not able to talk till around 10, 11 years. From 8 years onwards, she began to develop some speech. I knew what I wanted to say, but I could not get the words out. So I would just scream. So we are getting it straight from the horse's mouth. And Dr. Temple Grandin has been amazingly vocal about how it feels to be in the shoes of autism. Thank you to her that we know so much about autism. One more fact about autism is that under the DSM-5 criteria, there are three main categories. One is difficulties with socialization. They have difficulties with interacting and social situations. Number two is they have impairments in communication, verbal as well as non-verbal communication. So however hard they want to, they are not able to effectively communicate with a single finger point that I want that. So it is very difficult for them to communicate. And number third is they have restricted, repetitive, stereotyped patterns of behaviors, interests, and activities. And it also comes with associated sensory processing difficulties. So the implications of all these is that they have difficulty in imagining what the other person is feeling like. They find it very difficult to imagine what you're feeling like. They have difficulties in doing simple tasks. They have difficulties in sequencing tasks to complete one big task like brushing teeth, which requires a lot of small tasks. They also find it very difficult to shift from one task to another and to see the big picture. They have anxiety because of unpredictability in the environment. So sudden changes are always overwhelming and can lead to meltdowns. They have some coping strategies. They make their own rituals to cope with all the anxiety and all the stimulation that is happening around them. And they also have context blindness. They're not able to understand the context. We'll not get into that. We don't have time for that. So they have frequent meltdowns. Waiting is difficult for them. Following instructions is difficult. Paying attention to you is difficult. And staying still is very difficult. We'll skip this video because it seemed to be not playing right now. We'll go to the next point. So understanding autism and its strengths, they have some unbelievable strengths, unbelievable strengths. I work with them. I help them to adapt to their employments, to their work. And I know the kind of strengths that they have. They make an amazing workforce that neurotypical regular people are not able to have those kind of strengths that you need in a workplace. So if they don't interact with other people, so pretty much they are on the job all the time. They are focused on the job. They are passionate about that particular thing that they are doing, and they love doing that. So they can do the most tedious task without feeling bored. Most of the regular people would say, oh, please, I can't do this any longer. But people with autism can. They are very, very rule oriented. They are perfectionists. If you tell them this is the rule, they're going to follow it, come what may. They focus on details, on precision, on accuracy. And they don't have those biases. This job is not mine. I can't do this. They don't have those. They don't have those difficulties. And they are very visually oriented. Like Temple Grandin's famous book, They Think in Pictures. Yes, they think in pictures. So what is it that we can use to connect with them? We'll come gradually to these steps. So we'll come back to good. So now what happened, Bholu once, he had a tooth pain. Now he's having pain in the tooth, but he's not able to point to the pain. He's not able to point and localize the pain, that this is the place where I am having pain. So he's just crying and crying and crying, and mom couldn't figure out what is the reason for his crying. So then mom thought probably he has some pain, and she's a very well informed mom who has done many empowerment training programs. So she knows how to deal with it. So she tries to find out the location of the pain by helping Bholu to point. So she uses a chart, a body parts chart, and then she helps Bholu to point and localize the pain. And then she knows that, okay, there is some pain in the mouth area. So then she calls up the doctor. She tries to fix an appointment with the doctor, and she requests them for a less crowded slot, obviously. And as prescribed on the phone, she gives a painkiller to Bholu. Of course, Bholu had a tough time taking that medicine because of so many sensory difficulties that we talked about, but somehow she managed, and the pain was taken care of. And now she prepares Bholu for the doctor's visit. So today she got the appointment, and now the appointment has been fixed for 20th. So she puts it on his calendar. It's a visual clarity, giving him predictability that we have an appointment on the 20th, and again if needed on 22nd, because the OPD days are Tuesday and Thursday. Then she prepares a social story for preparing Bholu, mentally preparing Bholu. We'll go to the dentist on 20th October. The doctor will check inside the mouth to see what is causing the pain. He will then decide the medicine or the treatment. Now she's preparing Bholu. I can try to be patient and follow the rules. Mummy is there to help me at every stage. And she also puts in a lot of pictures to give Bholu a lot of visual clarity. He thinks in pictures, so she gives him lots of pictures to help Bholu understand that what should he expect when he goes to a dental clinic. Bholu's mama is scared, she's freaking out, but she's staying calm. She's trying to prepare Bholu thoroughly for that complex social situation. She also puts it on his visual schedule. So the schedules look like this. Most of the autistic people, they use these tools. They are powerful tools to help them stay calm, to help them stay informed, and they function best when they work through these schedules. So she puts it on the schedule that on 20th, we are going to go, on this Tuesday, we are going to go to the doctor. And she, on the day of the doctor's visit, she packs her Bholu stuff so that he's well fed, he's well taken care of. She packs all the tools that Bholu uses to communicate. For example, he uses these cards, these visual cards, to communicate and express himself. He also uses a card for weight. This is called a weight card, and it helps Bholu to give him a concrete reminder that he's supposed to wait while the card is in his hand. So it helps him to understand that it is waiting time. So, and she also packs his sensory bag, his sensory kit. So these are all the things that Bholu uses to calm himself down in overstimulating environments. A squeezy ball, some headphones, some fidget toys. Adults also resort to a lot of these sensory tools for helping them stay calm in difficult social situations. And then off went Bholu. He loves his car rides. He has a checklist. Mom is checking the list. Every time they are crossing a step, they are checking. So the cab ride is done. They reach the reception area, and Bholu's mom had imagined that the waiting lounge would either be absolutely empty or might have people. So she prepared Bholu for both. And in the social story, the waiting lounge looked like this, but in reality, when they reached the doctor's clinic in the hospital, it looked like this. So this is something that neither Bholu's mom had imagined, and Bholu had obviously not imagined. And what happened was, there were There was so much chaos, there was so much noise, there was so much sounds, there were so many smells, there were so many lights all around that Bholu had a meltdown. His emotional threshold could not take it any longer. He had a meltdown. And 4 to 5 people had to pick him up and carry him and help his mom to take him back into the car. And he had to be brought back home. Despite all the preparation, he had to be brought back home. He had a meltdown. The videos are not playing. My apologies for that. This is a beautiful video that shows an adult in a hospital environment, and all the little tiniest of things that can overstimulate a person with autism and lead to a meltdown even in an adult. So
Ma'am, it will be great. Ma'am, it will be great if you could share those links to me. I will share it on the group.
Sure, fantastic. I'll do that. And it will be very helpful and insightful for people to see. So what happens is then Bholu comes back home. So the first visit is wasted. He is back to square one. And now what happens is mother prepares Bholu for the next doctor's visit. So in the social story, it comes, now we will go to the dentist on 22nd October. Now she prepares him even more. There can be crowds, there can be sounds, there can be lights, there can be clutter and confusion. There can be many things that I'm not prepared for. We can have to wait. Doctor will check inside the mouth. He will decide the treatment. We can try to be patient. Now this time what she does is she takes out pictures from the website of the hospital. And she possibly also requested the receptionist to post a few pictures. And now she puts real pictures into the social story. And so she prepares Bholu in a much better way for the next doctor's visit. And then Bholu went to the doctor and his treatment started. So let's see what could have been done in the first go. We are trying to create a system of inclusion. We are trying to create a system for including people who are left out of these healthcare facilities because of their social limitations. So it is also our responsibility to try and include them. So what could be done instead? Maybe if the reception staff can be primed and sensitized, which is not a big deal at all in this world of information and networking. So the reception staff can be primed and sensitized to give appointments for less crowded hours. And they can even inform in advance that Bholu's mama, this is, I'm speaking from this clinic, and I think this is not a good hour to come inside. So if you can just wait for 30 more minutes, it will be a better time for you to come in. So it could be possible if we prime and sensitize the staff in any hospital, in any clinic in the world, even the smallest of clinics. We can have a calm corner where as soon as a person with autism or with some special needs that leads to sensory overloads, they can be directed to this calm corner. A calm corner doesn't take any equipment. It just takes some pillows, a clean rug or a carpet, some quiet place where the sounds are lesser. There are less sounds. And a calm corner is a place where a child with autism can straight away head and calm himself down. So that's what a calm corner is, and it is very simple to create such corners. We can also create specific days on the calendar for our OPDs. We can create these days on the OPDs, like for example, Fridays can be kept one particular hour for people with special needs, especially for people with autism. We can create a system like that. For all kinds of urgencies, we can have a phone interaction first, an initial phone interaction, in which we can call the patient 15 minutes ahead of the rush hour. So if the doctors are arriving at 4 o'clock for their 4 to 7 OPD, they can call the people with special needs at say 3:30 or 3:45. So a 15 minutes prior to the rush hour can be arranged. So when a person with autism is scheduled for an appointment, phone consultations work fantastic, the initial ones. Pictures on the website for mental preparation. The family prepares the patient well before coming. A crowd-free slot is selected. The reception is informed. Waiting is minimized. We can keep some waiting fidget things in the waiting area. We can use some soothing music, some sensory videos. We can create a proper structure for keeping shoes, bags, water bottles that freaks them out if there is no structure in a place. We can give a checklist to the patient. I'll just bring out the checklist. It works wonders. I'll just talk about the checklist. So what are the various adaptations that the practitioners can use? They can use a lot of visuals to explain any simple thing. They can use pictures, objects, and videos. I'll just show how. They can prepare the child well. It is the responsibility of the receptionist to keep informing the parents or the family to prepare the child well through desensitization and social stories. The practitioners can ask for a recent assessment. That really helps. It takes just 10 minutes for a practitioner to go through a recent assessment of that person, and that gives you a lot of cooperation indicators or cooperation predictors. What are cooperation predictors? Cooperation predictors, according to many studies, are a set of 5 or 6 questions that, if asked before the person visits, can give you a lot of information about how the person is going to adapt and adjust with a setting. So for example, when you're taking a medical or a dental history, preferably on the phone, you can ask a set of 5, 6 questions, and through which you can actually predict how much cooperation you're going to get from that person who is on the autism spectrum. These are called cooperation predictors. A lot of studies have been done on these predictors, and they give us good amount of information. Some of the social stories that are readily available on various platforms for going to the dentist or going to any clinic are here. We also create customized social stories for our people, for our students, and that helps them immensely to be prepared for visits. Now, what's a checklist? Like I said, like Golu was ticking, I have done this. The cab is done. The waiting is done. The entering the clinic is done. So dental visit is done. So that's what a checklist is. It gives details of what is going to happen throughout this visit, and the person can keep ticking it. So you make payment at the counter and wait for your turn. Then you come inside the dental meeting. You wear shoe covers or remove shoes. You sit on the dental chair. You open your mouth and put the probe. So it goes like that, and the person keeps ticking. So the person has a lot of predictability and certainty about what is going to happen. And work systems work like this. These are called checklist work systems. We create work systems for everything, for preparing our people or students for any visit, any mall visit, any movie, any task that they are going to do. And it makes it very, very simplified for them to do it. So it is as systematic as counter payment is done, waiting is finished, shoes are done. Now I'm on the dental chair, mouth opening was done comfortably. The dentist has already seen inside my mouth. The probe part is also done. Then I have to rinse. That part is done. Maybe an X-ray or some other examination or something else that needs to be done is done. The X-ray is done. I've said a thank you to the doctor. My visit has been successful. Shoes part is done. I've picked up the prescription from the counter. I've checked the next date, whatever next date is available, and the doctor visit is finished. What an achievement. And he has visual clarity about whatever is going on throughout. So that is very, very helpful. So the doctor visit finished, you did great, you get a token or any reward or reinforcement, and your next visit is rescheduled for this date. This is a visual that can be put up to tell that patient how to sit on the dental chair. Give clear instructions. Work system works like more and more clarity about what can be expected. There can be strong lights. You can close your eyes at that time. A towel might be placed on your chest and it's okay. A tray might be kept. One more important thing, there could be suctioning. It could make some noise and it's okay. And the most important thing that we can never forget is nothing will hurt you. You will be safe. If anything hurts, just raise your finger. I will correct it. You are safe with me. Acknowledging the fear. Regular people are so scared. Regular people like me, we are so scared. You must be scared of sitting on a chair or going inside a medical clinic. At times, everybody, just acknowledgement of that fear helps. It works wonders. You are safe. Don't worry. Everything will be all right. I'm here. Okay, so that's what works. So visual clarity. This is called visual clarity. So visual clarity. You are point by point giving clarity about what is expected from this visit inside. Then add reinforcements. Everybody loves to get rewards. Everybody loves reinforcements. And people who are on the spectrum definitely love to get concrete rewards. Anything that's concrete, not just saying good job, very good, come back again, we'll see you. Beyond that, something beyond that. So anything which is concrete works wonders for them. So you can say, after you do a good job, I'm going to play that song, your favorite song, or you'll get a cool, nice drink, or you'll get a coupon for the next visit, or you'll get a token. Tokens work wonders. We use these tokens all the time. They are fantastic tokens. Nothing but a piece of paper which has written good job on it. They love to collect it. I'm not just talking about little children. I'm talking about adults also. They believe in concrete things. So if something concrete is given to them, then they believe that, yes, I have done a good job and I'm collecting all these. So these are handmade cards that we give them. So the students make them, the younger students make them, the elders utilize them as their reward cards. So they keep collecting their reward cards or reward tokens. They love to collect them, and it keeps them motivated. It keeps them motivated. So these are some examples of visuals that you can use to explain your point. How do I want you to say? Visuals are best supports to explain anything because they are concrete. When we give an information verbally, when we speak it out, it just disappears into the air after a while. But a visual stays. It is concrete. It is consistent. It does not vary from dentist to dentist. One dentist said something, the other dentist said another thing. But if there is a visual, a standard visual, which is put up in the clinic, that is consistent. It is precise. It is to the point. The voice modulation can happen, but in a visual, if there is a visual, it is precise, it is clear, it is predictable, it is concrete, it doesn't change. So visuals are best supports to explain your points to people with autism. We have to remember this. When a person with autism comes to the dental clinic, acknowledge anxiety, like we said, stay calm, speak softly and to the point. They are not able to take clutter. We have to minimize the talking. We have to keep ticking on the checklist. It is the parent who can do it. If he's an adult, he can do it himself. But we have to remember that this is a person who is used to working through systems, work systems. So we need to reduce the clutter and confusion. We need to reduce the noises. We need to give more and more clarity, more and more predictability. Now, for example, if we are doing a procedure and it is taking longer than expected, we need to explain it to the patient by saying, oh my God, this procedure is taking longer than I had expected. So I will finish this procedure when the music in the background dies or when all the water in that bottle is finished, something like that. So a visual clarity as to when will this procedure finish, and then it's up to you. You can go. You can switch off the music when you're done. So it goes like that. Now if a person is getting anxious, now you realize that this person is getting anxious, the threshold is about to be there, this person is getting anxious, I'm in the middle of a procedure. See, you have to decide whether you can give a break or not. If it is possible, try to give a break. They need breaks. It could be a sensory break, it could be just a movement break, it could be a quiet break, a snack break, or drink a sip break, a washroom break, any break. If it is possible, accommodate it. If it is not possible, ask through a visual, do you want to hear a song while I continue with the procedure? Will that make you feel better? Many of the people are able to respond to that. Would you like to go out and come back for a little while I attend to another patient, if it is possible for you? So that ways you give a break to that person and you can attend to another patient at that time. Try to identify the trigger. If you feel that a meltdown is on a verge, ensure that there is no trigger like thirst, hunger, sleep, fatigue, etc., etc. If possible, reschedule. If it is not possible, you have to continue. So for continuing, we need to have some systems in place for helping those people to communicate. If they're not able to communicate verbally, they have to have a system there for asking for what they want. If they need a break, there's a break card. If they're thirsty, there's a water card. If they need a snack, there's a snack card. Of course, snacks are not possible in the middle of procedures or examinations, but for waiting times, yes. So they have a lot of sensory needs which can be satisfied with like a 30-second or a 1-minute break if it is given at the right time. So we need to identify that this is the time that this person needs a break, a quick short break. So all that a person needs possibly is stand up, jog at one place for count of 10 and sit down again. That immensely helps a person who is on the autism spectrum. That's called a movement break, a simple jog break at one place. Sometimes a music break, sometimes you need to go out and just come back, that's it. Sometimes a quiet break in a calm corner, sometimes a snack break. Whatever is possible at that time, that needs to be worked out. Similarly, to manage their anxiety, an anxiety management chart helps and works wonders. It works wonders if there is an anxiety management chart right there in front, and it's a visual reminder. All you have to do is direct that person to the anxiety chart, management chart, and help him to revise the steps, and he's back. Now, if a meltdown happens in a healthcare setup, if at all a meltdown actually happens, what can be done? What can be done? The only thing that can be done is stay calm and do nothing. Make sure that the person will not be hurt and any other person will not be hurt. If there is a meltdown, nothing needs to be done about it. It is just like an emotional meltdown. When a person or a family member has an emotional meltdown, we sit down and we listen. And that's the best thing that we can do at that time. Similarly, for a person with autism, if he's having a meltdown, we sit at a safe place, we ensure that he's safe, we remove all the dangerous things from around his surroundings, and we wait for the meltdown to get over. So for the changes and adaptations that we need to incorporate, we need to incorporate a lot of visual structures. We need to incorporate work systems. Work systems are the strips that we just saw that we were ticking. This part is done, this part is done, this part is done. Those are visual work systems. So anything that has visual clarity and a structure helps them to reach to their maximum potential. So for teaching an autistic person to brush teeth, you can create sequence of steps visuals. Many are available at all platforms. I'm sure all of you must be using them. For explaining about the next visit or the next procedure, you can have a stepwise visual handout. You can make them, keep them in your clinic, and those procedures can be explained visually through small pictures, and they can be given to the family. So before you come for the next visit, make sure that this person is prepared for this procedure. I'm going to do this procedure, and step-by-step visual picturization is given in this. Similarly, for teaching good oral hygiene habits, we can have visual strips, checklists. Gadget-friendly checklists are very, very useful, because paper checklists can get lost. Gadget-friendly checklists remain and are very easy to maintain. This is a dashboard from Sunrise Learning Awaz. In Sunrise Learning, we use this app called Awaz. And we have been using it for the last 3 years. It was developed by IIT, Team IIT, specifically for people with autism. And it is a brilliant app, I must say. People are able to communicate effectively, meaningfully, and they can go on to any extent to express themselves through this app. So we have created a lot of visual structures for teaching not just tasks like brushing teeth, but also complex tasks through this Avaz app, and it's working wonders. Desensitization for oral procedures can also be done before a person visits for the next procedure. And desensitization means giving that stimulus that the person is aversive of in small doses each and every day, gradually increasing the dosage. So for the first day, we touch on the outside, then we gradually take it inside, then we do a gentle stroking, and gradually the person gets physically and mentally prepared for a procedure, and that is called desensitization. A great approach for teaching them various complex skills like brushing teeth is through videos, making demo videos. Many of you are already doing it, which is amazing, which is very helpful for all the people on the autism spectrum, because videos are giving visual clarity. Now, there are many gastrointestinal conditions that are associated with autism, like GERD, very, very common, gastroesophageal reflux disease, esophagitis, ulcerative colitis, inflammatory bowel syndrome, malnutrition. These are associated very commonly with people with autism. In fact, many studies have shown that autism originates in the gut. I'm sure all of you have already heard about it. So yes, along with this, there are hygiene and sensory challenges that we just discussed. There are lack of regular checkups, which again complicates the situation. And there are limitations in pointing to the exact place of pain, which again complicates the entire picture. So what can be done? We can, in every visit, as healthcare professionals, make sure that a person with autism gets a good dosage of probiotics every time we need to advise antibiotics or otherwise as well. Probiotics are very, very helpful for people who are on the autism spectrum to keep their gut healthier. And we can encourage intake of high fiber and water. We can do that as healthcare professionals. We can also make sure that they eliminate every possible source of packaged food and beverages. All possible packet and chemical food and artificial coloring and flavoring agents is completely stopped. It is completely stopped. It is our responsibility to make sure that whoever comes in contact with us, we inform them that this is poison. This is poison for you. So you can stop it, eliminate it from the diet. We have already done this, healthcare setups, clinics, creating a system, less crowded hours, delegate a specific person who we can sensitize and prime and who can be the point of contact for the patients with special needs. And we can do a lot of work on phone appointments and reduce waiting time. We can create a waiting area that's more sensory friendly, like Calm Corner. We can create visual supports to help them understand what is going to happen, to give them clear expectations, to give them visual clarity about what is going to happen. There are many, many charts that are available for clinics and for nursing homes. We specially design those charts. We have a team who design charts that are suited for various places, for various, we have design charts for the airports, we have design charts for many public places for putting them up so that people with autism can effectively communicate with the environment and can understand what is expected from them in a public place like this. So these are some charts, examples of charts. This is a pain chart through which we help our people to express how much pain they are feeling, where they are feeling, which part of the body they are feeling, what kind of pain is it. So with adding a little concrete element, pain is a very abstract thing. It is very difficult to explain. So we have added a concrete element to it by giving it colors and numbers. So they are able to relate to the colors and the numbers because it is very concrete. Similarly, for their emotions, when they have to express their emotions, we categorize them into zones. So when they're feeling very happy, it is a green zone. When they're feeling a little edgy, it is a blue zone. And when they're anxious, nervous, freaking out, it's a red zone. And so they're able to come out that I'm in the blue zone right now and I need a break. So that is very helpful for them because it's concrete. Anything that's concrete helps them. So I'll quickly summarize what we are talking about today. So the problem is that people with autism have many health issues, but despite this great need for healthcare access, they are left out because they have complex social limitations. And so their health issues remain unaddressed and unattended. And the entire process of visiting a doctor and going to the healthcare facility becomes a painful experience for them and their families, as you saw in Bholu's case. And so people with autism have huge difficulties in accessing the healthcare, the amazing healthcare facilities that are available at our setups. They are not able to access it. Many a times they even have meltdowns. And once they have a meltdown at a particular place, obviously everybody develops a fear for going to that place again. So gradually their families get cut off from such complex situations and they kind of adjust with the ailment, with the condition, with the prevailing difficulty. And ultimately they are deprived of regular medical dental checkups and even treatment. They are deprived of the treatment. So how can we be the change? What can we do? We are doctors, we are professionals, healthcare professionals. We can do awareness and inclusion workshops and meetings like this one to create more and more understanding and awareness. We can create structural and systematic changes. We are the ones who can create changes in the system. We can make a system for inclusion. We are the ones who can implement these changes by delegating people at our workplaces. We can review and revise all those changes by taking feedbacks from people with special needs. Is it okay? Is it working fine? We can create systems to maintain those systems, and we can try to digitalize our systems as far as possible. So we are made to be the change because we are doctors. We can. What can we actually do? We can design autism-friendly healthcare systems and facilities. We can create OPD systems that can accommodate people who have special needs without causing distress to the family or even to the professionals. However long the journey is, it always starts with the first step. Let's take the first step now. And remember, we as doctors are made to build bridges. So all we have to do is to decide that, yes, I decide to make sure that I will include people with special needs. I will make some operational steps. I will create a system. I will do some tests and trials, I will work to overcome barriers, and I will review it. So what do we have here? We have a DOCTOR. We have a doctor who is willing to build this bridge between the neurodiverse and the neurotypical world. And so we have so many more inclusive people today who are right here in this gathering. She's Dr. Temple Grandin. This is her famous quote that says, "I am different, not less. I belong to this world." So welcome to Autism Land, all of you. And with this, on this note, I want to finish my talk here. This is a picture of our team, Sunrise Learning Foundation, that works for empowerment, employment, and inclusion of people with special needs. Thank you so much. Thank you so much for giving me this opportunity once again.
In fact, ma'am,
Could
we
you
are very
please
blessed to
stop
have
sharing?
you.
Madam, could you please stop sharing? Madam, could you please stop sharing? So that...
Yeah, I stopped the share.
All right.
Thank you so much, ma'am, for this wholesome presentation. In fact, you know, impossible is just the word. It is where like I am possible, and you totally make it true for us. I'm sure many of us has benefited a lot from your speech today. In fact, you can see the chat box. The appreciation has been pouring in ever since. We have few questions for you, ma'am. Dr. Priyanka ma'am wants to ask you.
Ma'am, before we start questioning, there have been appreciation not only for you but for Bholu as well. So people are really appreciating Bholu.
Absolutely.
Sorry, appreciating?
Bholu.
Oh, my baby. Okay, thank you. Yes.
So with this, coming to the questions, Dr. Priyanka ma'am has a question for you. Since you already said that it's very commonly undiagnosed, so how do you think we can diagnose autism in the clinics and setup?
For autism diagnosis, we need a team of 2 people at least. One is a clinical psychologist and one is a pediatrician. So these 2 people together can use the DSM criteria, and initially when a child of around 18 months comes to us, we can apply a list of high-risk indicators. They are called high-risk predictors, and that test is called MCHAT. It's an MCHAT that you apply, and then you get to know that this seemingly has many red flags, and this child needs to be observed more closely, and we start early intervention. And by the time the child turns 3 years, we can apply. There are many tests that are available to apply, but all the tests are questionnaire based. So there is no diagnostic test, as in a blood test, that can diagnose autism. So we need to apply those questionnaires, ask the parents a series of questions, and on the basis of that scoring, we come to know that yes, this child is on the autism spectrum. So I had mentioned one of those, the DSM-5 criteria. So the 3 main categories that are mentioned in the DSM-5 criteria, those were mentioned, and each category has like a list of many 6 more questions, and then sub areas. So we need to keep asking and keep ticking, and then based on that, a scoring is taken out, extracted, and then a diagnosis is made.
Can I slightly mold my question? First of all, thank you so much for such an inspiring presentation. I would just like to mold my question pertaining to the clinical practice. Can you hear me, ma'am?
Yes, I can hear you, Dr. Priyanka.
Actually, ma'am, in the clinics, if some patient in our clinic, if he comes and we can see him fidgety, and and the parents are not aware that the child is autistic. What is the sign that can tell us that we should tell the parent to go for an autism check or go for some psychologist intervention for the clinical point of view?
If you remember Bholu, and if you sit down and make a list of all the features that Bholu came up with, you can actually make a similar list for that particular child and inform the parent in a very gentle way. See, it is a very difficult difficult step for a parent to take in accepting that my child is different. That acceptance doesn't come very easily. Many of them are in a state of denial. Many of them are in a state of he will gradually develop speech, he will gradually begin to sit down, he will gradually. So there's a lot of denial. And as soon as you bring this to the notice of the parents, they are already in a state of anxiety. So you need to bring this up in a very, very gentle way, very, 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 very gentle way. And you also need to point out that at this time, I feel that this child has this, and this particular feature, which kind of seems like a red flag in the development. If I compare this child with other children of his age, they are able to sit down pretty nicely, listen to my instructions, follow my instructions, but this child is not able to do that. I would suggest that you should also consult a pediatrician, or a pediatrician is the first place to go. In fact, first consult a pediatrician, and then if the pediatrician advises, you might as well get this child evaluated with a clinical psychologist also. Having said this, you will also have to remember that yes, many of the features are overlapping with many, many, many conditions. There is a lack of sensory motor actual play in most of the children these days. I'm sure all of you would agree that 3-year-olds are way more fidgety, and every 3-year-old is labeled as a hyperactive in preschools, in play schools. All the teachers want to call them, these children are hyperactive. They are children, they are not hyperactive, they are children. They want to explore, they want to touch, they want to go here, climb, come down. So they are just being themselves. But at the same time, clinicians and healthcare professionals like you and me also need to be very, very aware of the possibilities of a child developing differently. And we need to bring that out in a very gentle way to the set of parents.
And this question actually I asked from my clinic only because we are getting patients who are ADHD, who we feel are ADHD because they are fidgety. So they're kind of, some of the features that you explained are overlapping with them. So that's why I asked. And
ADHD is a huge overlap with ASD. That's why the umbrella, that's why the big umbrella, very big overlap.
I think the catch line will be that, we have to be very cautious while telling the parents, because they might not accept, it might explode even, that they have different names here, and in the Indian setup, it becomes really, really, a social taboo to call someone something.
Thank you so
much. Very true, sir. It's actually a stigma in our society. We don't like to speak about these things, and let alone to accept that the child is autistic or anyway they are in special needs. The next question we have from Sandhya ma'am. She would like to know which department helped you in making the Awaaz app.
Which department helped me in, sorry?
In making the Awaaz app, yeah.
This is an app that is developed by IIT, Team IIT, for people with autism. And we use this app. We have not developed it. We customize this app for our students, for our children, and we hold innumerable workshops, training workshops for parents, to helping them to understand how to use Awaaz to help their people, to help their family members, to help their children. Young adults with autism are themselves attending these training workshops to improve their communication abilities using Awaaz. So it's an app that has been developed by Team IIT for people with autism. Okay, is Awaaz app available? Is it paid or free? Okay, a very good question at this time. In April and October, normally Awaaz app is available for 8,000 rupees. But in the month of April and October, they give it, the Awaaz app team, they give it for 50% discount, because October is Sensory Integration Processing Disorders Awareness Month. So it is a beautiful month in which we have conducted this webinar, and also Awaaz app is available for 4,000 rupees. I have nothing to do with Awaaz. I am not related to Awaaz in any way. It's been developed by Team IIT, and I can write the website on this chat box. Awaaz app. Okay, I'll just give it to you. I'll just give it to you. Anything else that anyone would want to know? Let me just give you the website.
Do we have any other questions? Actually, the chat box is filled with appreciation, ma'am. I hardly see any questions there. And you had been so perfect in explaining the things. I'm sure most of us, we do not have a doubt regarding this.
Actually,
I think the lecture was
thinking for
the
us.
lecture was more of a sensitization, because many things we ignore while in practice, and we are there focused only on a particular part of body which we are specialized in, and not looking at that it is a part of body and it might improve the overall status of the patient who is there. We have a doctor, we are doctor or specialized. The more we specialize, more myopic vision we have. The more we look broadly, such things can be managed, and we might have a better practice. We might give a better.
We all forget the person. We focus on the disease. We focus on its management. We forget the person, and sometimes it's more important to heal the person than to heal the disease itself. If we heal the person, the disease also kind of ceases to exist or manifest itself.
And just one thing I need to ask: have you seen this ADHD? This autism overlapping with any other syndromes like Downs or anything?
Downs is a absolutely different genetic condition. Autism is overlap very commonly with sensory processing disorders. Sensory processing disorders, like I explained, sensory difficulties. It is overlapping with ADHD, attention deficit hyperactivity disorders. It is also overlapping with OCD, obsessive compulsive disorders. These are the three main categories of conditions that are seen very commonly overlapping with ASD. I've given the contact of the Awaz app here on the website. Oh, it's gone privately. Hang on. Everyone.
Wonderful, ma'am. Wonderful to hear a new world. We might explore it with research. We might explore it with some venture, but surely this will make a change in our lives too. Dr.
Absolutely, absolutely. Thank you so much, ma'am, for giving us your valuable time. I actually mean it. You won't know, but we had been planning this lecture since long. But all's well that ends well. It coincided with such a beautiful month, and we had you. And then I must want to say that this was one of the best lecture we had till date. And most of our participants has benefited a lot. They say, like, they seriously have written that you have already inspired many of us. And that is what is important.
Would like to add one more thing, ma'am. Ma'am, usually we have a specialized lectures which are focused, and such sensitive issues. Maybe gathering around 60 people might change. Even 10 people is our job is done, because there are people who are not even I mean, I'm not able to put it in words, but how well these 60 people are lucky, because we have number of people, they might join us, but there is no impact. This lecture, I'm sure, will have an impact on many. It will form a chain reaction, I'm sure.
Thank you so much. And like I always say to all the parents, that whoever we meet, if we explain even one person about people with special needs, we have one more inclusive person in the world. So we are touching and making people more and more inclusive, and gradually this entire world will be an inclusive world. So we'll have a bridge finally. So let's keep meeting, and let's keep making people more and more aware. So
and you
thank
have a
you.
compliment on that. You have a compliment on the chat. You look like Juhi Chawla. Dr. Sandhya has written.
Thank you so much. Thank you so much. How can I read this chat box? I needed a couple of minutes to go through it.
There is a chat written just at the center, at the down. You will see it just next to the green button. There is chat.
No, I can see all of them, but if the meeting is finished, how will I be able to read them? That's what my question.
I'll send it to you.
Thank you so much. Thank you so much. Means a lot.
That will really make you happy, ma'am. Not that you need it, but seriously, there are some such wonderful comments over there. You need to go through it. Anyways, it comes to an end. So thank you so much, ma'am, for your time. On behalf of our team, it was really an honor and privilege to have you with us, ma'am. And we are very blessed to have such an enthusiastic audience base for us. We had the constant support from your side. So that is what makes us to come up with different ideas. Thank you so much. And with this, I would like to end this session.
Thank you once again. And my email ID is right here on that chat box. Thank you once again. Thank you.
Thank you, ma'am.